Good morning to all of you. Today our procedure on positions. There are different positions that are used in hospital setting. The first position is supine position. It defined as lying on the back with arms at sides. This position is used for physical examination of the anterior part of the body. It also used after lumbar puncture and spinal injury without a pillow. During assessment of vital sign, this position also used. This is a prone position. It is defined as lying on abdomen with head turned to one side. In this position, the patient is made to lie down on abdomen on a flat bed. This position promotes drainage from the mouth and useful for patients who are unconscious or those recovering from surgery of the mouth or throat. It also used to examine the spines and back of the patient during physical assessment. It relieves pressure on the back. It also used to relieve abdominal distension. Used for patient with injuries and burn, surgery of back. It relieves pressure on the back, coccyx and hips. This position is called side lying position and lateral position. In this, lying in the left or right side, supported behind back and between knees and ankles with pillow is a good body alignment. In this position, the patient is made to lie on right or left side with both the knees slightly bent toward the abdomen, but the upper knee is bent more than the lower knee. This lateral position helps to relieve pressure on the sacrum, coccyx and heels in people who sit for the much of the day or confined to bed rest in fuller or dorsal recumbent position. It also used to promote lung and cardiac function. It relieves spine hypotension in pregnant women. For examination of perineum and rectum. It also used for inserting rectal suppositories and flatus tube and for monitoring rectal temperature. This is a Sims or lateral decubitus position. Defined as lying on the left side in semi-prone position with right leg flexed and drawn up toward the chest. Left arm is positioned along the patient back. It is also called a semi-prone position. It used for rectal examination or treatment of rectal area. It also used for administering enemas and suppositories. It also used for unconscious patient because it facilitates drainage from the mouth and prevent aspiration of fluids. It is a comfortable position for pregnant women for sleeping. Also used for sigmoidoscopy and proctoscopy. This position is Fowler position. It is a semi-sitting position with various degree of head elevation. It is a high Fowler position. In this, head of bed is elevated to 90 degree. It provided to the patient with difficulty in breathing. It also used while eating and drinking without risk of aspiration or choking. This position is given to the patient with the support of backrest and pillows. This is a cardiac position and also known as orthopedic or tripod position. It is a sitting upright position with the head of bed elevated 90 degree. Patient may lean slightly forward with arms raised and elbows flexed. This position helps in easy breathing. This position permits maximum lung expansions for gaseous exchange because the abdominal organ do not pose pressure against the diaphragm. This position is used for to assist the patient in severe respiratory distress by allowing chest to expand to maximum capacity for moving air in and out of lungs. It is also used to perform thoracentesis. It is a therapeutic position patient with drainage. This is a knee chest position and also called genupectoral position. In this position, the patient kneels on the bed with thighs vertical and chest resting on a firm pillow. The head is turned to one side and the hands are flexed around the head or on the bed. This position used for rectal and vaginal examination and a treatment to bring uterus into normal position. This position used for gynecological and rectal examination and surgeries like lumbar spine surgery. For the pregnant women who suffering from cord prolapse, this position also used. This is the primary position for sigmoidoscopy, also used for enema administration.